How's your health at the moment? Looking after yourself doesn't need to be complicated. My goal has always been to share clear, reliable information that you can use every day. And that continues right here. So follow on, subscribe, and make trustworthy health advice part of your weekly routine. My guest today is a leader in her field. She's one of the UK's leading experts in medical tattooing and scar camouflage. She specialises in scarring, skin grafts, treating burn survivors and people born with port wine birthmarks. I'm delighted to welcome Rae Denman. Hello, Rae.
Hello.
How are you?
Yeah, really good, thank you.
Keeping busy?
Yeah, very busy. Nice to be on here.
I think it must be true to say that people with visible differences, particularly of the face, find life challenging. I mean, there's all sorts of psychological issues involved. It's not just the physical appearance, but getting through life, not being discriminated against.
Yeah.
This is the kind of area that you're specialising in. You see people with all kinds of things. When people come to you, what do you think they're most looking for?
Oh, that's a good question. What are they most looking for? I think a lot of people that come to me are not wanting to necessarily have to speak about whatever the visible difference is on a day-to-day level with either with friends, family or strangers. And it seems to be that if it's visible on the face, then obviously it's something they can't necessarily cover up. They may be able to cover it up. And it's not always confidence. A lot of what you give with medical tattooing is helping them get back to regain a confidence. But I think a lot of it is choice of how they go out into the world and how they want to portray themselves and not being defined by the visible difference. So they may get comments on the street, everything by well-meaning people. Friends and family may talk about it a lot, but it's having that choice of not being defined by a port wine birthmark or by a scar. And actually, even when it's covered by, there's quite a lot of research that even when it's covered by clothes or it's in an area that doesn't get seen by many people, that can still cause just as much concern because they're nervous about people finding out about it. So then they're even more covered and try to keep something covered all the time. And also, it's very much about how they perceive their identity, how they perceive appearance, and how they think other people perceive appearance. So sometimes it might be the tiniest of scars, and it might be in an area that can be covered, but it can cause so much anxiety that they don't want to show it to anybody. So most of the people that come to me will not be having those conversations with other people, maybe not with their doctor, certainly not with family members or partners sometimes even.
Right. Yeah.
And that's what I find quite interesting. So it's quite a safe space for to be able to try to camouflage as much as possible, whatever that means.
In my lifetime, tattooing generally has sort of taken off as a fashion, as a trend, as somebody trying to create an identity. But medical tattooing is almost the opposite. It's not adding something; it's trying to minimise something else. Is that true?
That is exactly what it is, and it's actually, I find it actually a lot harder. Although I've never done normal body tattooing, because you're adding something in order for it to not look like it's there. So actually it's quite difficult, and it is very different from normal body tattoos. And yeah, it is trying to take away a part of an identity that where people don't want to identify with their visible difference.
Right.
And it's different in the sense of normal body tattooing because we use pigment, not ink. So ink doesn't fade over time because it's a big molecule, sits in that layer of skin and can't move anywhere. But it does revert to primary or secondary colours. So all normal body tattoos will turn blue, red, green, yellow, whereas we need browns and creams. They're the only colours I use, browns and creams.
Right.
So we have to use, as a medical tattooist, you have to use pigment, much smaller molecule, goes to the same layer of skin, but over time it will travel through the layers of skin, enter the bloodstream, the lymph will come along, process it and remove it. So it fades over time. So on some level that's quite good because your skin tone may change over time. You may want things slightly placed in a different area if you've had surgery. But it also means people have to have colour boosts every couple of years sometimes. I mean, I had somebody come back the other day after 12 years. So it can last a long time. But some people may need colour boosts every year, every 2 years.
Now, we mentioned in the introduction that you specialise in port wine stains. And for those people who don't know what we're talking about, these people will have seen port wine stains. So it is almost as if port wine, deep red wine, has left a stain on the face.
Yes.
So this is a nevus, it's a birthmark, it's permanent, it's a collection of blood vessels, and presumably the medical tattooing to disguise that involves tattooing with a lighter colour.
Yes.
Is that right?
Their skin tone. So mostly what I tattoo with is mostly it will be on the skin, might be on area of hair or wherever, but mostly it'd be on the skin. So yes, we are using pigment. I will match their skin tone. Depends on what the person looks like, but usually I will have somewhere between 2 to 5 colours, different colours within their skin tone. And then you are trying to implant as much pigment, one that will be held in the skin and 2 that will be retained by the skin, over the whole area. So some people have quite a light pink port wine birthmark, especially if they've had laser when they were young. Some people have very dark red, purple port wine birthmarks, and they take longer to cover, but you can still get really good coverage. So in my experience with doing it over the last, I've done tattooing for port wine birthmarks for about 8 years now. You can get a good 40 to 80% coverage. In fact, on smaller ones, you can get up to 95% visible reduction. And I've recently worked with a patient who did a presentation with me last month, actually. It was fantastic. And she had a good over third of her face with a very dark port wine birthmark, and came to see me. We must have started 1.5 years ago. Nearly 2 years ago. And at the time she'd covered it up for 30 years completely,
just with
every
makeup.
day, just with camouflage cream. Every single day. Oh, well, actually, she was using makeup every single day. None of her colleagues knew that she had a birthmark. Only really her mum and close early friends. I said initially that I thought it would take quite a number of sessions to cover it up, and it did. It took 13 sessions, and we would usually have somewhere between 4 to 8 weeks in between them. But what it really, it changed things that we didn't even realise. You know, I can go through medical tattooing and make lots of changes for people, but this was, the way she interacted with people was vastly different. So as soon as it got to about 50% covered, she then was able to tell people, like her old boss, who she'd known for 20 years, she'd been to his mother's funeral, she knew him really, really well. And because she was working from home, coming to see me, having treatments, and she was working from home for the next few days afterwards, he got quite nervous that she was poorly. So she said, actually, I have a birthmark and I'm having treatment. And he said, oh, my son has a port wine birthmark. He's having laser treatment. Is that what you're having? And she was like, no, I'm having medical tattooing, actually. But she said it wasn't an issue to him. It wasn't an issue. No. And then it opened a door to having a conversation, and their connection grew from that. And actually, a lot of the conversations she's had with people since, when she's shown them a photo of a before medical tattooing, you know, people have been really upset that she's had to go through that alone, that, you know, she hasn't been able to trust people enough.
Yes.
So that's been a really good, positive change for her, of ways that she wasn't expecting and I wasn't expecting.
Yes.
We were just going to do this because she wanted it covered.
Yes.
And now she will go out without any makeup on. It's not 100% covered. You know, it's probably 80%.
That's very good still.
Very good. And she will open the door without makeup on. She will go and stay with people and not need
really
makeup
good.
on all the evening. So
for the first time in her life?
For the first time in her life.
Wow. I'm just doing the maths in my head. So it's a large area, third of her face, deep red, and 13 sessions. So each time you're covering quite a big area. Is it uncomfortable for the patient?
I mean, that on the face, especially down the midline where there's so many nerves, it can be tender. We will use a topical anaesthetic, but depends on how long I do a treatment. But yes, it will be tender. I can do certain treatments with no anaesthetic, and there's certain areas of the body you would think were really painful, and sometimes it's not painful at all. But I think midline of the face, it can be quite tender. And for her, we were doing 1.5 to 2 hour treatments. So by the end, you're going over, she's had enough. And it was a lot for her. Not painful, but very tender. But when people are concerned about that, quite often that's quite a big area that we were covering, and it's on the face. Generally, it's not particularly a painful treatment.
Okay.
Yeah.
What about scars and stretch marks? Because they're the bane of many women's lives. But stretch marks after childbirth, for example, or after drastic weight loss.
Stretch marks are a difficult one. Stretch marks can be tattooed. They react really differently. Scars, I find a lot easier. They will hold the pigment better. It actually works a little bit like microneedling, so it can sometimes change the texture of the scar, soften it, and you can get really good retention and coverage with scars. Stretch marks, because the skin is broken and it's so thin, you then have to dilute the pigment so you don't see so it looks natural, so you don't see pigment underneath. What you're looking for is not to be able to see the pigment at all. You don't want to be able to see that you've got something there. So I've had really good results with some stretch marks, and other stretch marks, there's a lot that I turn away because I know they won't get a good result. And that might be down to the person's particular skin tone, especially if they're really, really pale, or it might be just the texture of the stretch mark. So it will depend.
But that's a sign of a good therapist who says, actually, my best advice to you is not to persevere with what you'd like because it's not going to work. Yeah. And unfortunately, there aren't enough people who do that.
No, and I that's something I'm really strict with is I will refer to somebody else, or, Camouflage cream is a great solution for people. It's safe, it's easy, it's affordable. Camouflage cream is a great solution if medical tattooing won't work. Yeah. Some people could have laser, microneedling. There's so many different alternatives, or some people may not be able to have any treatment, and then I guess there's psychological help that they can have if it's really concerning them.
So we talked there about the treatment of scars where you don't want to see the pigmentation, but there are other conditions where you do want to see pigmentation. For example, with hair loss, that's an area where you do want to increase pigmentation, perhaps eyebrows, eyelashes, eyelids, and there you're deliberately using a semi-permanent tattooing.
So same thing, it will be the pigment, it will be the same type of pigment that you'll use for scars, stretch marks, port wine birthmarks, and we will recreate an eyebrow, lash line, or lips. If somebody's had cleft lip surgery and they haven't got the Cupid's bow, you can add colour and symmetry to the lip, especially for men as well. I've had a young lad recently wanting to going off to university, very asymmetrical from surgery from when he was young, and just creating a natural. It's easier with women because you can maybe create it and make it look a lot more defined and a lot more colourful, as if they've got lipstick on, whereas with men it needs to look absolutely as natural as anything. Brows, absolutely. You can do just very fine hair strokes. So sometimes you need to recreate a whole brow, and sometimes people may have gaps from scarring or just from age or overplucking or something. And that's and same with nipple areola tattooing. You know, then you're wanting to see something.
Yes, exactly.
Yeah, and in a way that's easier.
Yeah,
I find that easier.
Talk about that in a moment, because the other areas, if say, for example, a guy's got a patch of hair loss on his beard area, it'll look quite obvious if he wants that, you know, a sort of a beard which is short, but he's got a patch here. You can actually improve on that.
Yeah, so you can do SMP, scalp micropigmentation. So there are some people that purely just do SMP and that's all they do. And they can create like a shaved head look with a full, you would have to keep your hair shaved all the time. And they do tiny little dots of follicles. I do that. I don't do full head ones, but I do hair density and beard density. As long as somebody, when they shave, you can see the little dots, because otherwise, when you're fully shaved, you know, some people are very smooth, aren't they? So you wouldn't want to tattoo it in that case. Yeah. But it's actually a really lovely treatment to do, because you just sit and do hundreds, thousands of tiny little dots. To make it look like it's a shaved beard or a shaved head.
Absolutely. Now, you talk about nipple not reconstruction, but pigmentation.
Yeah.
So we're talking about, obviously, mainly ladies. There are a few men who get breast cancer, but if there's a mastectomy and the nipple is removed, that I suspect that would be more disfiguring than if the nipple is left intact, but sometimes it has to go.
Definitely.
So what can you do there?
So definitely people, I think one of the things, after having been through so much trauma and surgery and getting to the end of it, and then feeling like you have, I have been told by some ladies that it feels slightly alien when they look in the mirror. It's not like anybody else is going to see it. It's not like they can't cover it up with a bra and clothes. But when they look in the mirror, if there's no areola, it looks different. And so I guess psychologically as well, that's just always reminding them of the journey that they've just been through. So you can create, and you can essentially draw on an areola and a nipple, and with careful shading, highlighting, you can create a sort of 3D structure. So some women will have a nipple reconstructed, so they've actually got the middle bump in the middle of the areola. But if they haven't wanted to go through that, or if it's flattened, then you can tattoo it so it looks like it actually protrudes out, with sort of highlighting, shading, and creating the whole shape. Yeah.
Okay, that's great. And so I guess that people who come to you, I know that you deal with them with sensitivity, with empathy. You have to talk things through, see what they're looking for, tell them what can be achieved, what can't be achieved, and obviously with discretion. That's quite an art, you know. Before you even start the treatment, you must have to sort of nurture them and gently cradle them a little bit.
It's interesting that you notice that, because yes, I think that's partly, for me, it's what makes me good at my job, because I really like people, and I've worked with I did, when I was sort of 16, I did care work, I've done palliative care. I like working with people, and I like people, and I like to be able to nurture them and to help them. And that's why I'm there. I'm happy that I can use my skill and my interest and my artistic capabilities, which is I like drawing on people. But to use it in a way that somebody wants, which is actually, can you cover this up for me? So there's a lot of I will always have a consultation first, and it's about trying to work out where that person is, what their expectation is, whether I can give that to them. If not, where they can go, because I don't want to just send people out there, because again, there will be somebody who says, yes, I can do that for you, and it's not the right thing. And you know, maybe not saying that I can't get rid of scars, I can't get rid of their visible difference, I can only camouflage it, and working with them, helping them understand that journey, that it might take a long time, it doesn't always go to plan, it's not a high risk treatment, so if anything goes wrong, it is something that can be sorted out, but that's not really that's not where people want to go, because they want to get the good results, and have to say majority of the time medical tattooing can give the results that people want. But it is about working with them to find out what really they are looking for.
Because you have worked in an NHS hospital burns unit, haven't you? And that must have been a very valuable part of your career.
That was at the very beginning. I loved that. I was really grateful. We lived in Wales, and at the time when I first found out about camouflage cream and medical tattooing, all of the burns and plastics units in Wales had amalgamated into one hospital, Morriston Hospital in Swansea, which was a good hour and a half away from me. But I phoned them up and they ran a camouflage clinic, and the camouflage practitioner said, "Oh, come in and observe me," knowing that actually she lived a long way away and she wanted to move on. So she was like, "Great, come in, see if you want to take over." I eventually trained in camouflage, took over her clinic. And they also did medical tattooing there. So they did nipple areola tattooing for post-mastectomy and breast reconstruction patients. And it was the lead burns nurse who did it. And as you can imagine, she was incredibly busy. She didn't have a lot of time. She had a huge waiting list of women. So I then trained in nipple areola tattooing and took over her clinic as well. Right. And I loved that. I loved working in the NHS. I would happily work in the NHS again. It was only having to move from Wales back down south, where I grew up, that took me out of the NHS and into private practice. Right. But it was wonderful. Again, you're meeting people, you're able to help them. You're meeting them at the end of their journey. They've all got stories. They all want to share with you, you know, and you can give them just that little final touch. At the end of their quite traumatic journey.
It must be very rewarding. Yeah. Do you know, I don't know if you've seen the book, The Facemaker. It's a book I've just finished reading. It's extraordinary. It's about Sir Harold Gillies and his early work in the First World War, treating soldiers with largely facial injuries. And what was extraordinary is that soldiers would come back from the war after amputations and they'd be treated as heroes. But if they'd had facial injuries, maybe the whole nose had gone, or the cheekbones, or the entire mouth and jaw had gone, they had to hide away, that they wouldn't be accepted by society. So to a lesser degree, I expect, the work that you're doing must be so satisfying for you and rewarding for your clients.
So do you think
clients.
That's where maxillofacial started?
Yes, it did, in Sidcup.
It is.
Yeah.
So that's also where camouflage cream started.
Interesting.
Sir Archibald McIndoe.
Yes, that's right. Later
it was all the people from the Second World War coming back, and they'd had all this advancement in surgery, so lives were being saved, but they were disfigured or burnt, scarred, and they created camouflage cream for that. At the time, it was a really thick product. Yes. And now it's an amazing, fine, highly pigmented product to cover that.
And of course, some of the worst injuries were burns from warfare. So Harold Gillies started earlier than McIndoe and he did the first skin grafts. It was all pioneering work.
I didn't know
the pedicle grafts. So it all started from there. But it's a fascinating read. And I was
I'll read it.
Yeah, The Facemaker.
I loved when I first started in camouflage cream and medical tattooing. I went to the maxillofacial doctor in Morriston Hospital and had a look at his work. Yeah. There's only about 12 in the country, 12 people that do it, and when you've trained in it, you tend to stay in it for life. Yeah. And some of the things they create, eyeballs and full noses, amazing. And I mean, it's so realistic.
It is incredible. They can sort of almost rebuild the face with blocks and then camouflage with latex and
incredible.
And the camouflage.
Yeah, I would love to have gone into that.
What's the most rewarding area in your work? What do you enjoy doing most?
At particular treatment. Oh gosh, I don't know if there is a most rewarding.
It must all be satisfying, I guess. You're helping people, and I think what I find rewarding is the connection with people. Yes. That's what I find rewarding. So, if I can help somebody, I do like working with scars. I like 75% of my work is scar work, and I like working with scars. Yeah. But I don't know. I wouldn't say a particular area of the body because within a day you can work on so many different areas. I'm sure. Yeah.
Yeah, I don't know.
Do you work with the Katie Piper Foundation?
I used to.
Okay.
Yeah, I used to work with Katie Piper, mainly in camouflage,
right?
Not necessarily medical tattooing, but we used to run days where we would have kind of maybe 6 severely burn survivors, severely burn patients, and we would do camouflage cream. They would have wigs made for them. Somebody might do their nails. If it was a chap, it might be how to dress and how to use camouflage cream. So I used to work with the Katie Piper Foundation, but she doesn't do so much of that anymore because she's set up her clinic where she's got certain what was it that she wanted from France? A certain treatment machines.
Yes.
Yeah, so she doesn't run those days anymore.
Right. Okay. But what you do obviously changes people's lives. Do you think enough people know about the kind of work that you and your colleagues do? Because it strikes me that it's not well known enough about, and that if people are only, I'm hoping they're going to be listening to this podcast thinking, do you know what? I've got an idea now. I could maybe get something done about this or that.
I don't think it's that known. I've been doing actual medical tattooing and camo for about 20 years, but medical tattooing for up to nearly 15. And I used to do a lot of talks at women's institutes because I thought, actually, how can you get this message out there? If there's a group of women who are listening, then they're going to talk to their friends and their family. And I spoke to lots of GPs but I'm just so busy now. I can't go round spreading the word. So most people struggle to find somebody and it might take them a long time. But I think because my website's been up for a long, long time and it gets lots of traction, so they will Google and find me. But it's not necessarily something that is part of the referral pathway, which would be good to do.
Absolutely.
Good to have.
Medical tattooing. It's something that we need to raise more awareness about, and hopefully we help to do that today, Rae. Thank you so much for coming on, and keep up the good work. And before you go, for the latest health news delivered straight to your inbox each week, subscribe to my newsletter at drhilaryjones.com. We'll keep the conversation going about your health, your well-being, and what truly matters to you.